and I feel like I've learned a huge amount in our chat already today. But I do want to make sure that the listeners leave with maybe 3 top action points, and we need to be, I guess, specific here. And I want to get on a bit more to adult stuff in a second as well, because I've got some more questions there. But in terms of the kids, let's say for the GDPs listening, for the general dentists, what are the 3 things that they should implement in their practicing lives on, we'll say Tuesday morning, because it's a bank holiday on Monday, that can make a meaningful impact in helping these kids? Because they're not going to be able to treat it straight away. They're not going to be able to do the early inception orthodontics that you do straight away. What can they do?
Number 1 is learn screening tools. So I'm the orthodontic specialist. You can come to me. I send you the list, 14 points. You see what it is. If you don't understand what it means, malampati or tongue tie, you can read about it. Surusagi Breathe Institute LA.
Is that available online somewhere?
Absolutely.
Can we put that in the show notes or something?
Yeah,
like that,
so I can
link?
send you my screening tool, no problem.
Brilliant, that'd be great.
Yeah. Otherwise, it's the Ferris 6 from Surusagi published. Breathe Institute in LA, Stanford University.
Right.
Ferris 6, this is where my assessment is based on. Now it's Ferris, in adults, it's Ferris 6 plus 4. It's all there. Okay. Free available. So you start screening. Breathe Institute in LA. Surusagi. So you screen, then you have you count the red flags. If you have moderate or high risk in red flags, because you counted red flags, you know, okay, there could be an issue. That's it. If you're not confident in doing anything about it, refer to someone who is. If you want to learn more about it, I'm here. Yeah, we have a teaching academy. My passion is to teach dentists. If orthodontists want to, they are welcome. Pediatric dentists to learn screening tools, and if they want to learn the tools how to treat it. We talk about adults in a minute. In kids, it comes down to aligners and maxillary expander. Easy. Aligners are 3D metal printed devices. They fit like nothing. Aligners are easy. There are companies out there now who have even myofunctional trainers with the aligners. So it's happening. I'm very much involved in this space. I want kids to have good access to aligner companies.
And so the dentist should be making the diagnosis on the tongue ties?
No diagnosis, no.
No.
Dentists should assess a risk.
Even for intraoral characteristics?
Absolutely.
Okay.
They say, what if they don't know the classification of tongue tie, you can learn. If you're not sure, then you're not sure. Okay? But then you refer to someone who can do it. The diagnosis, also myself, I don't diagnose tongue tie. Because tongue tie diagnosis consists of my diagnosis, a myofunctional therapist diagnosis, and the surgeon who's going to release it. Right. If all 3 of them feel there's a need for release, you release. This is best protocol. Because if they're not prepared well for the release, you can't release because it gets reattached. So this is a topic itself. So if you want to know about tongue tie, go to Surusagi Breathe Institute, 3-4 days, you will learn everything. Yeah, he does it online, everything. Best address. Yeah, if you want to do tongue tie releases, go to him as well. His best address, Richard Baxter is another one. Yeah, they will teach you tongue tie assessment. But tongue tie only plays 4-5% of the picture.
Okay.
That's not the big part. The craniofacial complex, the narrow, high palate, that's a big point. Also, mouth breathing is not big. A high vaulted palate where the tongue doesn't fit in. This is a big one. If you can't expand, there will be people like me who do.
The parking space.
Because otherwise you stand on the road blocking the whole traffic.
Yeah.
That's exactly it. So your job is not to diagnose. You are not an airway dentist. You're not an airway orthodontist. Your job is to assess, is there any risk? And whenever you plan a case, could that negatively impact my parking space? If it does, either you get a smaller car, which is hard, yeah, or you accommodate that car. But don't decrease the parking space because the tongue will not park in there.
Okay. So screen every child using your 14-point test
or the 6
the 6-point test from the Breathe Institute. And then where you see whatever the appropriate number of these red flags is, you're then going to be referring to an interceptive orthodontist such as yourself.
Well, there are not many who do that,
which is the challenge. Or you're going to train yourself up. And then do any of the sorry to interrupt, but do any of the red flags, do they also indicate a referral to a sleep physician?
Absolutely.
An ENT surgeon?
Correct.
Is that all clear within the screening structure? So basically,
the minute you feel there is a high risk, you need to refer to an ENT. That's your obligation. And if you have done diagnostic like X-ray, you send them with it. Mm-hmm. That's the first point. That's his duty. You need to refer. Sometimes you're not getting anywhere with it because you have to wait God knows how long and they popping you off. But you have to do that. Mm-hmm. Yeah. So you need to refer to an ENT if you see anything. Even if you have a child and it looks not happy, we call it venous pooling. Mm-hmm. Yeah. Tired face.
Dark circles around the eyes. Yeah.
Behavior problems. Tossing, turning, you mentioned night terrors. These are all red flags. Then you say, oh, look, this child is not doing so great. I don't know, but I know something can be done. But I can't do that, so I want to refer to someone who can screen you. This is the biggest thing and best thing you can ever do. And if they come to my office, I will say to them, give whoever referred you a bunch of flowers. Today, midwife who spotted on their friends' kids, you are tongue-tied, 11 or 8 years old. So she came to me, I told her everything, she had sleep apnea. The midwife said, who is their midwife? Buy her a bunch of flowers today, because she flagged up there might be tongue-tied and might cause you a problem. So your job is not to do everything. Nobody expects you to do that, but if you are concerned, if your gut feeling tells you something is not right, and there's people who talk about it, there can be help. At least give them the opportunity to get that access to that help. Mm-hmm. This is what you should do. And then, if you want to, you can get knowledge. Knowledge is not free, but it's available. And then you can develop your skill. And I tell you, everyone who came through my program in kids never ever regretted it. I have people who changed their whole career from adults to kids because they felt so passionate about what they're doing. I have a 30-year-old young dentist who opens her own clinic now in Belgium based on kids.
I'm not surprised. I mean, as you say, the impact that you can make is quite remarkable, isn't it?
Absolutely.
Of everything that we can do with our profession, it's got to be one of the biggest.
It's not a line bleach bond. This, I can tell you, this is so much bigger than that. To see these kids thriving, growing, behavior changes. Like we had yesterday a teenager who said to us after we started expansion, snoring gone, jawline developed, his performance increased. This is 3 weeks into treatment. Mm-hmm. I mean, this is emotional.
Yeah.
You know?
And just to reinforce the point, I think we have to remember that for us as dental healthcare professionals, we're one of the few health professionals in the world that get an opportunity to see these kids on a regular basis every 6 months. Nobody else is seeing them unless there's a problem. So if it's not us, then who is it? And I think as we started the conversation with, yes, there's concerns. Yes, there's animosity surrounding this debate. I certainly feel that anyway. But actually, as you say, isn't it worth that animosity to have the potential impact that can be had?
I really like what you just said. Look, my goal in everything being exposed is not to fight.
No.
My goal is to tell people there are opportunities. And my core intention is to anything I do is to try to help the community, the kids predominantly. Now I do adults as well. To live a better life, a healthier life. You do that when your lifestyle changes as well. You will do that with your own children. There's nothing bad in that. To try your best and your opportunities to use them. Yes, it needs to be based on evidence, but the evidence is very limited at the moment. But just because there is no evidence doesn't mean there's no evidence. It's just not there yet. Like a lot of orthodontic things we do are not based on evidence. They're based on case reports. It worked, so we're doing it.